Ooh. All right, good morning, everyone. Welcome to the first virtual Portage County Safety Council meeting. We're very excited today about today's sponsor and presenter, and just having this opportunity to bring everyone back together. Today's presentation is COVID-19, Unmasking a Novel Pathogen by Kristen Dickerson with the Ohio BWC, and our sponsor is Sumi Health. We're very excited for all of this today. I want to give you a couple ground rules and housekeeping pieces before we get started this morning. If you have any questions, we encourage you to utilize the chat feature. Make sure that your chat feature is set to all participants and panelists. That way our panelists can capture those questions, because at the very end we will have a question and answer session. We will get to as many of those questions as we can, and then follow up afterwards if we're unable to answer all the questions today. All members are muted, so we will not be able to hear or see you today, but you can see our smiling faces. We will be recording this presentation and then posting this on our Portage County Safety Council's YouTube channel afterwards. So if you find this information valuable, we encourage you to go back and share this with your employees and fellow coworkers, and let everybody else know. Also, we're asking you to help us out, spread the word about Portage County Safety Council. We'll be holding these meetings every other week virtually for our members, with exclusive access to this and exclusive access to the recordings to help you improve your safety and health program. My name is Nick Koya, and I work with the Ohio Bureau of Workers' Compensation. Many of you know me from the meetings. Those who are new to the council, I am the local safety council rep, and I'm here to provide some updates from the state of Ohio and from OSHA, and also talk a little bit about our services this morning. You know, during this COVID situation, things have changed a little bit. We typically are in the field visiting employers on a daily basis, but we've just shifted gears some, and we're virtually consulting now. This has been very successful for many of my customers. So if you have questions related to safety and health programs, or you have questions related to even just machine guarding or other safety practices on your floor, please let me know. We can schedule a virtual appointment through Microsoft Teams. We can look at your shop floor virtually. We can do program reviews and help you move in that direction. Additionally, we're offering virtual training for staff. So we can bring your staff together in a safe location, and then I can virtually come in and present on various safety topics. We want to remind everyone that the Ohio BWC does offer training classes. Currently, we have canceled in-person classes for the first and second quarter of this year, but we do have a webinar series at bwclearningcenter.com that we encourage you to check out. There's a lot, this is a hot topic, today's presentation, and we want to remind you that you can find all the information you need to know about coronavirus at coronavirus.ohio.gov. There are many great resources here. In fact, I steer a lot of my customers to this website to help them find the answers they need to coronavirus and working safely in the workplace. Also, to help with this, we have created a web page called Responsible Restart Ohio Safety FAQs. This is where we have compiled a list of many of the questions we have received related to safety and restarting your company in the state of Ohio or continuing operations during the COVID-19 situation. Here you can find the answer to those questions. And if you cannot find the answer to the specific question you have, just let me know, and we'll get you the best answer we can, and then that may eventually end up on our FAQ page also. We want to remind you that this is Safe and Sound Week through the Department of Labor, OSHA. We're encouraging everyone to take a moment to stand down and talk about safety within your workplace. This is a snapshot from earlier this month or this week of many, many companies across the United States who have signed up on OSHA's web page and pledged to be engaged in the Safe and Sound Week. This process ends tomorrow, but that doesn't mean safety ends. We continue to offer safety and engage our employees in safety, but I encourage you to check out their Safe and Sound Week website, volunteer to be part of that, and show your commitment to safety and health within the United States and your company. As always, if you want to find additional information on the Ohio BWC, you can follow us on Twitter and Facebook. You can also check out our webpage. And then I am always available too, before and after meetings, anytime. My contact information was on the first slide. Let me know, and we can help you with that. With that, I want to introduce to you today our sponsor, which is going to be Sumi Health Systems, and that's going to be Kelly Harvey. Kelly, thank you so much for sponsoring today. The floor is yours.
All righty. Okay. Okay, I think that got it. Is everyone seeing that okay from the beginning? Okay, all right. All right, well, good afternoon, everyone. I am Kelly Harvey, and I am an outreach specialist with Sumi Health, and I just really appreciate everyone giving me a few moments of their time this morning, as well as Portage County Safety Council for allowing us to be a sponsor. I just want to give you a couple quick updates. First and foremost, I'd like to talk with you a little bit about our Sumi Health Corporate Health, which is an occupational medicine program that we have conveniently based in Portage County for employers. We are located at the NeoMed location, and we have a medical provider 5 days a week, Monday through Friday, 7:30 to 4 p.m. to serve a variety of your corporate health related needs. So I've been with Sumi for a number of years, and specifically working in the occupational medicine arena. And I will just tell you, in working with employers as well as our corporate health program, we really do put employers and their employees at the forefront. We truly have a customized approach. We like to really get in there and get to know your organization, whether that's a company tour, coming out, and just really, really learning about you, what your needs are, your protocol, so we can really custom design those programs. So Dr. Atta is our medical director, and we're so blessed to have him. He's wonderful. Kathy Farrell, who's on the call today, she's our director. And our goal is to really just place your workers according to their physical, mental capacities, and just to ensure that they are able to safely perform work that is acceptable to your degree of efficiency and your needs. So we really put health and safety at the forefront, and we really place an emphasis on just overall health and well-being of your employees with the goal of getting to know you to help you contain some of those healthcare costs. So just to give you a quick snapshot of some of the services that we offer, we do offer workers' comp injury treatment care. I would always encourage you as an employer to first call before sending in one of your injured workers. And then in addition to that, we offer a variety of employment physicals. That might look like an annual pre-placement exam. It might look like an annual physical, OSHA exams. We also do police and fire physicals, as well as assisting you with any CDL drivers that you have, performing DOT exams, as well as doing bus driver physicals for school systems, FAA, and for your powered industrial truck that you might have on site. So we do fit for duty exams, functional capacities, a variety of screenings, hearing, respiratory fit, drug and alcohol testing. We love to serve you by going on site. So that might look like us bringing our mobile health unit on site to your organization to serve you, whether that's a wellness screening or other screenings that we offer, as well as serving you at our Portage County NeoMed location. So, and again, addition to the substance abuse, drug and alcohol testing. So I'd like to kind of share with you just a couple updates on some plans for 2021 that we're really excited about. And this is going to be having our corporate health move into a new location in the medical building on NeoMed's campus. So we're very excited about that. We're also going to have, Sumi Health is going to have urgent care in there, as well as behavioral health, which I know obviously mental health is a huge need right now, and also lab care services. So we're super excited about that. I mentioned our location in Portage County. We also have 4 other locations to serve you. Cuyahoga Falls, and that does cater to a lot of our Summit County, Akron area employers. We have one in Greene, the Uniontown area, one in Wadsworth, and then one actually that serves Medina County. So employers are free to use any of those locations. If you would like any information on any of our service line offerings, we're always available. Please don't hesitate to shoot me an email or our other outreach specialist an email as well. So again, I'm Kelly Harvey, and then Lisa Horning would be my counterpart, and we're happy to help in any way. I know COVID's been a crazy time, so we've been doing a lot of webinar education to employers with Dr. Atta. And then we also happen to have Dr. File, who is a national expert on infectious disease. So he happens to serve as the he's the president of the American Society for Infectious Disease on a national level. So if there's any kind of noise going on, it's hard to sort through with the media with the COVID. We are happy to really approach it from a science standpoint and answer any questions that you might have, and even provide education to your employees. So thank you so much for your time.
Hi everyone, it's Debbie. I'm so excited to have everyone here listening to us. And I'm even more excited, not about COVID, but the fact that we can get our fingers and hands on someone who is really an expert in talking about this, even though as much as none of us really want to talk about it. Today, I'm here to present Dr. Kristen Dickerson. She's a Statewide Health, Wellness, and Special Program Manager at OCOSH-Ohio BWC. Let me tell you, this bio is impressive, by the way. Kristen Dickerson is the Statewide Manager for Health, Wellness, and Special Programs for Ohio BWC. She has worked in both the private and public sector at all levels of the government and within hospitals. She's obtained a bachelor's in microbiology with a MPH and PhD in epidemiology, as well as being a registered nurse and certified lab technician. In addition to working with bio-warfare in the Army and serving in public health service, she has been a regional infectious disease epidemiologist, infection preventist, quality improvement coordinator for the prison system in Ohio, and a program administrator for population health programs, in addition to being a visiting professor and subject matter expert for the Chamberlain School of Nursing. With that, welcome Dr. Dickerson.
Hello, everyone. I'm going to go ahead and share my screen because I've got a lot of information to get through. Okay, slideshow. There we go. Okay, so today we are going to be going over some of the virus basics, and just let me move some of these things that keep popping up. Okay, and we're going to go over transmission as well as contact tracing, isolation, quarantine, some source control, and mask efficacy. Okay, so a little bit about viruses, because I think if we go over viruses, it might help you understand the disease COVID a little better. Viruses are non-living particles. This means that they cannot replicate on their own. They lack a lot of cellular machinery that eukaryotic cells, such as bacteria and multicellular organisms like humans, have. They are submicroscopic. These little diseases, they actually only consist of DNA or RNA. They usually do not have both. And then proteins that kind of coat them and keep that DNA or RNA together. Because they are so simplistic, they can mutate frequently, and they can do this rapidly. Okay, so when we talk about mutations, they can be non-competitive, and what this means is that something happens when a virus replicates within a host cell. Something happens to the cellular DNA or RNA of that virus, and it makes it non-competitive. That means it kind of makes it less virulent. It can't infect people, it can't infect cells, and because of this, it kind of renders itself no longer infective to humans. Mutations can also help viruses evade the immune system. We see this a lot with HIV. Mutations can also make viruses resistant to antiviral drugs. Antibiotics are only used for bacteria, and they're specific for bacteria. When we talk about antiviral drugs that are specific for viruses, a lot of times these drugs, because viruses mutate so frequently, these drugs don't necessarily cure you, just like with Tamiflu. You have to take it within 3 days of getting the virus. It usually just stops you from having symptoms as long, and it lessens the severity. Because viruses mutate so frequently, this really impacts vaccines. This is why with the annual flu vaccine, we have to constantly get a new flu vaccine, because there's mutations that have occurred in the virus, and we have to be immunized against those the new viruses that are out there. There's research out there. I've seen both sides of the tale saying that COVID-19 may have mutated and become more virulent, meaning that it'll infect more people. Or also there has been research that says that it may infect more people, but the severity of the disease may have changed. The problem is these studies are so new that only 1 or 2 of the studies have been done. And in order for us in science to accept something, we have to have multiple case studies and multiple studies done proving that the virus is mutated or not. Okay, SARS-CoV-2 is what is causing the current COVID-19 pandemic. It is a coronavirus. We actually saw coronaviruses in 2004, and then again in 2011 and 12 with both outbreaks of SARS, and then outbreaks of MERS. The first SARS has completely gone away and we don't see it any longer. There are still people that are getting infected with MERS. It never hit the United States, which is good, because the mortality rate for MERS is 33%, which is much higher than we see with corona. This pandemic started like most pandemics. Usually the disease is found, just like with the flu, coronavirus is the same. The disease is found in an animal host. Somehow humans come in contact with those animals, and then the animal gives the human the disease. And then when we see human-to-human transmission, and then we see communities start to get sick, then the pandemic or the outbreak kind of spreads. Coronaviruses were actually first found in 1960, so they have been around for a while. Okay, so some of the signs and symptoms of corona, which change frequently, the CDC is updating them. Fever and cough are definitely the 2 most common things that we see, and a sore throat. Fatigue, shortness of breath. It usually is worse in adults or those with immunocompromised systems. 15% of people are known to show severe infection. So this means that these people need hospitalized, these people have to be put on ventilators. And what they're seeing is if you do get hospitalized with this virus and you do get put on a ventilator, you're on a ventilator for not just a day or 2, but it ends up being weeks or months. And there's a lot of therapy and rehab for those patients trying to come back to where they were before. Okay, so this is the timeline of SARS-CoV-2, which is what causes COVID. The incubation period for this virus is 2 to 14 days. So that means that if you are infected from somebody, you could start showing symptoms as early as 2 days after, or as late as 2 weeks after. So this is why we quarantine people that have been exposed, that we think have been exposed, for 14 days. They have been able to find out that most symptomatic transmission, so by this I mean if somebody's coughing or sneezing and you're around that person, most symptomatic transmission occurs when the virus reaches the back of the throat, which is about 5 days after infection. But they can be infectious 2 days prior to their symptoms starting. So this is why when health departments are doing contact tracing, they ask the individual with a positive COVID test, when did your symptoms start? And then they go back 2 days prior, and everybody that they've come in contact with is their contacts. We have seen asymptomatic transmission with this. And with asymptomatic transmission, it just means that you've been exposed to it, but you don't have any symptoms, but you can still transmit the disease to others. So this is why we're doing the masks and the source control, because people are transmitting the disease before they are showing symptoms, or they're not ever showing symptoms and they are still able to transmit the disease. Okay, we're all kind of similar, we're all kind of familiar, sorry, it skipped back. We're all kind of familiar with the flu. So this is a comparison between COVID and the flu, the annual flu. I'm not talking about the pandemic, the Spanish influenza of 1918. This is just the annual flu. So with COVID, there is a much higher mortality rate. At the beginning, it was 5%. I think the most current estimates are 3.7%, which means like 3.5 or 5 people out of 100 are dying. This is way higher than the annual flu. Annual flu mortality rates are 0.01%. So 5 to 0.01%, that's a lot higher. Those that are more at risk are people that are older, or those that are immunocompromised, those that have heart or lung diseases. And they are starting to see that the more you're exposed to the virus, the worse your symptoms are going to be. So if you were exposed to somebody that was asymptomatic and you developed symptoms, they're not going to be as bad as if somebody that had COVID coughed right in your face. Okay, those that are most at risk for infection are healthcare workers. Even though they have the PPE, PPE is not fail safe. There are accidents that happen. Things can get past face shields and they can get past masks. High areas of infection. So you'll see this on Governor DeWine's. He puts one out every day. It's the United States, and it shows where there's higher rates of infection, and so he's asking you to quarantine, and that's just because your chances of getting COVID if you go to those areas are higher, just because there's more infection. This is why we've started the mask requirement everywhere, because we're trying to stop people from transmitting, and it really lowers risk for infection because of source control, which we'll talk about a little later. Okay, this is a gross picture, but this is what it looks like when somebody sneezes or coughs. All those droplets come out of your mouth. Transmission of this virus is mostly through droplets. That means there's droplets coming through your respiratory system. So they're coming out of your nose, they're coming out of your mouth, they come out when you breathe, you talk, you sing. They actually say singing is one of the worst things that you can do, because you spray more and further, because you're using more lung muscles and stomach muscles to get out volume, and that's why kids and choirs have been kind of put even further distance. I think they're recommended to stand 20 feet apart instead of just 6. When we're talking about droplet transmission, there's a chance that these droplets can become airborne. And how that occurs is the droplets break down once they leave the respiratory system. So if they break down and they become small enough, they then get suspended in the air. Now, this happens with tuberculosis, and it is airborne. And this also happens with COVID sometimes, where the particles, if they're given a chance to break down, they do break down and become suspended in the air. So that means even if the person coughed and left the area, some of those particles could still be suspended in the air and you could walk through them. This is why a lot of the races, like marathons and stuff, have been canceled. And at the beginning of COVID, there was some thought that there's contact transmission, but the virus is not really viable on surfaces for extended periods of time. I know copper, it can only live on there for an hour. Plastic, I think it can live on there for 24 hours. So it doesn't really stay on surfaces much, and everybody's doing a great job at trying to clean all surfaces. So the chance for contact transmission has really reduced as the pandemic's gone on. The interventions that we're doing right now are all just to reduce transmission. This includes social distancing, which is 6 feet or more, and then also source control. So that's what we're doing when we're wearing a face covering or a mask of any kind. Source control reduces the amount of the virus spread to others. So if everybody is wearing a mask, and you're sick or you're asymptomatic, it stops all those particles from coming out of your mouth and then breaking down and becoming airborne, or then even spreading onto somebody else. Source control is very effective. There was actually 2 people that got sick in a factory, and everybody was required to wear masks, and they tested this isn't in Ohio. This was a study done somewhere else. And then in the factory, they tested everybody that had been in close contact with these individuals, and nobody tested positive because the individuals that were sick were wearing masks. So it stopped them from transmitting the illness. Definitely proper hand washing is one of the most important things that we can do, because while we're still concerned with COVID, we are starting to get into flu season. So that just makes things even more concerning. You're going to need to use soap and water. You need to use warm water, not hot water. When you use hot water, you can actually dry your skin out, which causes micro cracks in your skin. And all these germs, bacteria, viruses can enter these micro cracks. So it's better just to use warm water. 20 seconds. At least, that's singing happy birthday twice. Hand sanitizer works. It's not as effective as hand washing is. With both hand washing and using hand sanitizer, friction is what ends up breaking down the bacteria and the viruses that are on your skin. So really rubbing and scrubbing breaks down and it degrades everything on your hands. We've also started to do increased surface cleaning. So all those high touch areas like your phone, your computer, any surface that you're coming in contact with a lot, or others are coming in contact with a lot, they just need to be frequently cleaned. Okay, you may hear this, and it's PUI. I'm just going to go over 2 definitions real quick. It's called a PUI and asymptomatic transmission. So a PUI is a person under investigation, and they may be transferred at any time from being under investigation to a positive case. When we talk about infectious diseases, we don't call them patients. They become a case because they have to be investigated. So a person under investigation is somebody that has been tested for COVID and the result's not back and we think they might have it, or it's been somebody that has a very good chance of being exposed to it. So these are personal contacts of people that are being tested. When we talk about asymptomatic, again, this means that they have no symptoms and they can transmit the disease. They still don't know how much asymptomatic transmission is occurring. That's why we need to educate people as much as possible to use cough etiquette and wear masks and wash your hands. Okay, we're going to go over mask efficacy. And there's 2 slides because there's 2 things that we need to think of. We need to think of how are masks protecting us and how do masks protect other people. So when we talk about N95 respirators and the elastomeric respirators that you see the nurses wearing, these are to protect the wearer. Most of these respirators or masks, they have valves on them. And those valves actually end up putting out particles. And so that's why if they're wearing these masks with valves, they also have a face shield to stop any of their particles from coming out onto people. When we're talking about surgical masks, they do protect the wearer to some extent. I think they stop 60% of the particles from entering the person's respiratory system, but they're actually used to protect the people around them. So when surgical masks were made, so when a doctor's doing surgery, they're not breathing on the patient and they're not giving the patient their germs. So that's actually the reason for surgical masks. Face coverings have been found also to protect the wearer to some extent. And there are some face coverings, especially the ones with the 3 layers or there's a filter insert, that protect the wearer as much as a surgical mask does. And there are a lot of studies that show that if you're wearing a mask and you're exposed, chances are that you're not going to have the disease as severe as if you weren't wearing a mask to begin with. We also need to think about masks as far as how it protects other people from our germs. When we're talking about N95, it doesn't really help with source control. For one thing, you have to be fitted for it. But then on top of that, there's not a lot of studies that have actually looked at N95 and determined how it helps, particularly with source control. Now, you are wearing something over your mouth, so it is stopping a lot of those germs from coming out. So it does do that. Surgical masks and face coverings really do stop transmission. They stop when the particles are large, because the virus is in water droplets from your nose or from your mouth. They're large, and they end up hitting that face covering and getting stopped and stuck on that face covering. I know that's kind of gross. That's why we need to wash them if we can. They get stopped before they can go out further and then get into the smaller particles and become airborne and start infecting other people. You guys might have seen it. It was probably about 2 months ago, and it wasn't in Ohio, I don't think. But there was actually 2 hairdressers tested positive for COVID, and they saw, within 2 days, they saw 140 people. And those 140 people were considered close contacts because they were less than 6 feet, and they saw these people for longer than 15 minutes. Both the hairdressers had on face shields and face masks, and none of those contacts developed symptoms or became sick. So that just shows you how well face coverings of any kind work at stopping disease transmission. Okay, when we talk about, we're going to go into contact tracing now. This is what the health departments are doing, and they're starting to hire more contact tracers. This is when we try to track down who might have it, who might have caught it from people within the community. We actually do contact tracing anytime there is a case of an infectious disease that is reported. So this actually includes chicken pox, measles, because we've had multiple measles outbreaks in Ohio, even your STDs. We have to do contact tracing with any of these. And that's just to make sure that anybody that's been exposed receives the appropriate care and education to stop them from transmitting it to other people. Contact tracing is different for every disease because with sexually transmitted diseases, you're just looking at that particular type of contact. Now, if you're considering measles as another respiratory disease, so you're looking at, okay, who did they come in contact with for 15 minutes or longer and less than 6 feet? Contact tracing always starts with interviewing the positive case. And a lot of times the health departments are as specific as possible. And so they'll name specific dates and days. What did you do in the AM? What did you do in the PM? Just to make sure that they have a comprehensive list of everybody that person has come in contact with. when we're talking about tracing specifically for COVID, they look at they ask the positive case when they develop symptoms, and then they go 48 hours back from the development of symptoms, not the positive test, but from when that person first started to feel sick. They go 48 hours back, and then they ask them who they were in contact with. They also ask them, like, what type of activities did you do? Were you at any family gatherings? Have you left the state? These are all questions that they ask right now. And they're always asking, some states are 10 minutes or less, but Ohio, for the most part, and every health department that I've talked to or come in contact with, it's 15 minutes or less. So that close contact is if they were within 6 feet or 15 minutes or less. More, sorry. The purpose of contact tracing is just to identify and assess all those contacts. Once they have a list of the primary contacts, the health department calls those contacts and asks them if they're sick, if they have symptoms. They ask where they work, and they record all this information, because and they will track these individuals for 14 days. Because they're a primary exposure, they will also put them into quarantine, and they'll be quarantined at their house. And if they develop symptoms, they will transfer from being a contact to a positive case. And then they'll start the contact tracing with this contact that then became positive. They give them guidance too, as far as if they share a house with people. One of the things is if you're a primary exposure and you live in a house with others, try to have your own bathroom. If you're in a common area, wear a mask. And that's just so the rest of your family doesn't get sick until they know that you're not sick. Contact tracing is a 3-step process. It involves contact identification. So that's when that positive case comes in. Ohio has a disease reporting system that is electronic. So all infectious diseases from any lab in Ohio is reported into the system. Sometimes it takes a while, and because most of it is behind the scenes, and the labs all have algorithms that if there are positive cases of measles or chlamydia or COVID, they automatically get reported. They do not get they get reported to the positive cases primary residence. So if there is somebody in prison and their primary residence is they're in Noble County and their primary residence is Muskingum County, they will actually get reported back to Muskingum County. And this is just because that's where their primary residence is listed. Once they identify these positive cases, they ask about contacts and activities. They make lists of the contacts, and then they follow up with contacts and the positive case just to educate them about isolation and quarantine, and send out a packet of information as well as quarantine orders or isolation orders. Like I said, all positive cases are reported to the health department, and right now the health department has has to respond to every positive case of COVID-19 and start contact tracing and interviewing that person within 24 hours. This is why they've had to hire in some extra help, and contact tracers are now being hired. They have to do that initial interview with the positive case. And then from there, they work on determining who primary contacts are, and then they record all that information, and then another team takes it and starts to reach out to everybody in the community that might have been exposed. These are all potential exposures, so they're all put into quarantine. But all these contacts have to be interviewed, and the health department has to reach out to them. So if somebody went to a church service and they were sick and there were 150 other people in a room with them, those 150 other people would then be primary contacts, and then they would have to be investigated, and the health department would then be responsible for checking with them for symptoms. And we do have an electronic system in Ohio that you can sign up for, where the health department won't be calling you every day or every other day to ask how you're feeling. You can just sign up through email and say, I'm not sick, I don't have fever, but that's something that each health department will go over with a positive case and their contacts. Education and information is also gone over, like I said before. I think we basically went over this again. When we talk to contacts of the positive case, we also write down contacts of the contacts. So contacts of a positive case are considered primary exposures. Contacts of primary exposures are considered secondary exposures. The health department writes down this information, but they don't contact the secondary exposures. If the primary exposure flips and then becomes sick or develops symptoms, those secondary exposures will then become primary exposures. The health department already has that information and doesn't have to go get it again. And so then they'll start contacting those secondary exposures and let them know that they're quarantined. People are expected, if you're under quarantine or isolation, that you have to monitor your symptoms daily. And the health department will either be contacting you every day or every other day, or they will ask if you want to be put on the electronic contact tracing system that ODH has. Okay, so we're going to talk about isolation and quarantine. I've mentioned both before. They are two different populations. When we talk about isolation, we are talking about people that have tested positive for the virus, so they have a positive test. They have symptoms most of the time. We haven't had a lot of asymptomatic, but even if they're asymptomatic, they're still put into the isolation. People are put into isolation for 10 days, or if their symptoms resolve, 72 hours after their symptoms completely resolve, they can come out of isolation. There's a lot of times where we have people that are isolated, like a positive case, and then the rest of their family is quarantined in the same house. So you've got people that are isolated and quarantined in the same house. The thing is the people that are quarantined, they cannot come out of quarantine early. The only way they can get out of quarantine is if they end up getting sick and moving to isolation. So potentially, we've got somebody that can come out of isolation that had COVID. They can come out of isolation, but the people that are in the house still have to stay in quarantine. The requirements that we try to get everybody to have for isolation is they have to have a room and a bathroom to themselves, if at all possible. They need to wear masks in a common area and try to reduce interaction with other people in the house as much as possible. There will be extra cleaning that takes place. There will be a lot of education given to these people as well. Quarantine is 14 days from the last contact with a positive case. So if you have a positive case and they go to the hospital, you're put into quarantine, and you drop them off at the hospital, you're put into quarantine, and then you go pick that positive case up because they came out of the hospital, your 14 days starts over again because that was the last contact when you picked them up after discharge. So I just to be aware of that. Okay. When we're in isolation and quarantine, individuals should not leave their home, and they should not interact with people outside of the home, which is good because we've got DoorDash now and everybody's delivering and they're kind of just leaving food on the doorstep and running away. Okay. There are signed orders sent for each, and they come from the health department, and there are instructions on them. And the health department will call you and release you from quarantine and release you from isolation. And they'll also send letters, so those can be shared with employers. There are some times that law enforcement has to get involved in tracking people down because the health department can't get a hold of them. And the health department doesn't know. They will send nurses out to check to see if they can talk to these positive cases or their contacts. But sometimes they do have to get law enforcement to help because they're concerned that something's happened. Okay, and I think that is the end of it. Okay, so are there any questions?
Yeah, we have a lot of questions.
Oh no!
Here.
Okay,
Yeah.
I'll try to answer all of them.
All right, so let's start with, there's a lot of questions around masks.
Okay, yeah.
So the specific questions are disposable or cloth masks better? What about face shields? Are those okay to wear? And then there's is it pronounced Gator, Gaiter style masks, or no better than masks at all? So if you could address those.
Anything that you wear in front of your mouth and your nose to stop your spit and snot, for I can't think of a more scientific term, of coming out and like spraying on other people, it works. You can go, there's a whole bunch of studies that have been done. My favorite experiment is this guy that like sets fire to mannequin faces, and he puts it's really good. It's on Facebook, sorry. He puts like a mask on, and the fluid does not come out of the mask. But if the mask isn't there, it sets fire to the other mannequin. So honestly, anything on your face stops stuff from coming out. Face shields are good. Face shields actually, they do, so face shields stop stuff from coming out of your mouth, but it's not as good at protecting you because it's not sealed, because there is some protection that face coverings offer us from the virus infecting us. So that's the only bad thing about face shields. However, it's a lot easier to understand people. So if you're working with populations that are deaf or hard of hearing, I suggest that you wear the face shield because it does stop, but then people can read your mouth.
Great, thank you. On that same track, how safe are our workers who are wearing masks 8 to 12 hours for a shift in hot environments?
It will do nothing to your pulse ox. It will not reduce your oxygen levels at all. It's uncomfortable, but healthcare workers wear masks all the time. I know that there are specific variances, and you can check with your local health department on the variances, because if it is too hot and they're working outside, or it does get too hot and there's no way for the employer to have like ventilation, there are variances that employers can get for comfort and health and safety of employees. So I would suggest if it's a big problem, check with the health department.
Good.
And I want to add in there, Renee, I just talked to the Portage County Health District yesterday, in fact, and asked them some of these questions, and they want people to be as safe as possible all the way around. And so they get it. And so they're not your enemy. They're not looking to come shut you down. So if you have a question, I even addressed the issue of our members potentially being afraid to come to the health department to be on the list or get targeted. And they assured me that's not the case. So I know that's anytime there's a governmental agency, there's a fear there. So I just want to say, contact the health department. They're actually, even with the food inspections they do at restaurants and campgrounds and pools, they're really trying to make it healthy and partner with you on it. They're not looking to shut you down or fine you. So you don't have to be afraid of them. No. Feel free to go ahead and reach out to that.
Most health departments, that's what they want, is they just want an opportunity to educate you and help you, because they would much rather know that there are these problems that exist, and they don't want you guys to pass out. They really want to work with you and support you.
Great. The next question is, were we not working on a vaccine in the past years, and how close? I know that we don't have a crystal ball. What's the deal with the vaccine? What do we know?
So they worked on a vaccine, I think, both with SARS and MERS, but which they could use to start, but it took a while to identify at the beginning that this was corona, and then it took a while to identify how many strands that there, and I still think that the research is trying to determine if there's multiple strands out there or not. It does take a while to get this virus and run testing on it to get the genetics on it. So when we talk about viruses, they actually have to enter your cell to replicate. And so what the vaccine does is it's trying to mimic the outer portions of the virus. So then it will be injected into your body, and then antibodies will recognize that as a foreign body, and it will make specific antibodies. So then when the virus comes in, it will bind to the virus, the outside protein particles on that virus, and it'll make it so it can't enter your cell. That's the whole background of that. I do know, I just saw that I think Russia says that they have a vaccine. I know that the United States is working on, everybody is working on one. Yeah, I don't know if I would take Russia's vaccine. Everybody is working on a vaccine. They're trying to fast track all of it. I think that they were hoping on seeing something by the end of this year. That's the last that I had read.
Good. And then on the testing, I know that more tests are available now, and it's easier for people to get tested. How realistic are the tests that are going to be similar to like a pregnancy test or a quick
The
test?
rapid tests?
Mm-hmm.
Okay. So just like with every other rapid test, there's not a lot of false negatives. There's a lot of false positives with those tests. Because when you talk about the rapid tests, they're kind of, the rapid tests, because they're rapid, which allows us to test a whole bunch of people and get results fast, they're kind of dumbed down. So what that means is it's testing for pieces of a virus, but it might not necessarily be specific to COVID. When you do the PCR testing, you're testing specific for the RNA for COVID virus. Does that answer the question?
I think so.
Okay.
I hope that answers the question for our members. If you have another question, you can put it in there. We're getting close on time. So the last couple of questions, you reviewed some of the symptoms to look for: fever, sore throat, cough, trouble breathing. Are there any other symptoms?
Loss of taste, loss of smell are two big ones, and now they just added nausea, vomiting, and diarrhea. So pretty much, if you have any symptom, the list of symptoms keeps growing. If you want to know specifically what it is today, you just go to the CDC website, but the list does keep growing.
Great. And then if you are diagnosed as positive and they're doing that contact tracing, would you need to report people if you were wearing a mask?
Okay, so that's another thing that the health department actually asks. So you say that an example is a restaurant in our area. There was somebody that tested positive for COVID. She worked at the restaurant. She had a mask on. Everybody else there had masks on. So they did contact tracing with her, and they said, who did you come in contact with? Well, I worked with so-and-so and so-and-so and so-and-so and so-and-so. Well, did you wear a mask? Yes. Did they wear a mask? Yes. They're not considered exposures then. They will be contacted and they will be told you could have been exposed, but because they were wearing masks, they aren't necessarily quarantined. Does that make sense?
Yeah, that's great. That's just another good reason to have
Wear the
everybody
mask.
wearing masks.
Yeah.
Yep, absolutely. And so then another question came in here. If we're out in public and we're walking past people and you're more than 6 feet apart or about 6 feet apart, is there really a concern And how important is that time limit exposure?
The time limit exposure is kind of important because the longer that you're near someone, the more chance is, if you're just passing somebody in the hall, it's not a big deal. There's actually a sheet that the CDC put out, and it says risk. And I think if you do anything outside there and you're kind of staying away from people, there's not that big of a risk.
Good. And I think that is all the questions that we had. Great questions from our members, and we certainly appreciate you taking the time to answer all of those. And with that, I'll turn it back over to Mike. Thank you.
Yeah, guys, I do want to address one thing. Just because I looked it up, Wendy, thanks for the question. She mentioned there's about Gator Mask. I looked it up while Dr. Kristen was putting all the information out. A Duke University study just came out about the different effectiveness of different masks. Now, the cheaply made Gator masks that are real breathable, they said it'll actually thin out the particles to allow them to hang in the air. So that's why they said the question was, does it make it worse? So just to keep that in mind, and also the mask, the N95 with the ventilator, they said, again, like she addressed in the presentation, it protects you, but it also allows you to put it out a little bit. So I just want to throw that out. There's studies coming out every day, but like Dr. Kristen made a point, until there's multiple studies confirming it, the whole scientific process there. But I thought it was worth just to address for your own personal use, because I know I have friends that coach and they have the Gator and they think it has the same protection. So may not be the best bet. Maybe, let them decide. But with that being said, guys, our next meeting is going to be in 2 weeks, August 27th. It's going to be presented by yours truly, Nick Coyle of the Ohio BWC. As you can see him laughing there. It's going to be finding facts, not faults, how to improve safety after an injury. We did a podcast and some similar stuff a little while back, and it's actually real phenomenal. I can't wait to hear more info about it. And while you're on the line, I had at least over a dozen registrations this morning. And just so you understand how important it is to register before the deadline, I manually approve every registration, for one, to make sure only our members are getting in so you guys get what you pay for. The second thing is to help prevent hackers. So people can't just come in and take the screen over. So I manually approve every one of those. I've had over a dozen registrations today. And unfortunately, once we start the webinar and we start 15 minutes early behind the scenes, I can't exit out and go approve you. So please make sure you register. Don't let that sit in your email inbox. Register as soon as you get that thing. That way it'll send you a notification and get you the link back. And so that's it. I hope you guys enjoyed it. Kelly from Suma, thank you so much for coming out and telling about the awesome services you guys have. To our steering committee, thank you. Dr. Kristen, thank you so much. It was awesome information. And I did have questions about this. Yes, we are recording this. I will put it up on our YouTube channel. I think I'm going to make it public because it's COVID-19. We do have a password protected page on our website that we're putting on. But I think I'll make this a public link so anyone can see and get this information out there. So I will email that out to probably all the members, actually. And if you're not on that list, I know, Vanessa, you're probably not on that list, but you're with the agency, you can go ahead and shoot me an email or look on our website. I'll have that up there. So again, thanks everybody. Have a good day.